Good morning, everybody. New South Wales had 5 cases of community transmission last night, and Dr McAnulty will go through them in detail. 2 of the cases we'd already discussed yesterday, which was the gentleman that presented to Mount Druitt Hospital and his household contact. So those 2 cases we'd reported yesterday. There have been an additional 2 cases in the Northern Beaches. Obviously, Dr McAnulty again will report on that, and 1 case linked directly to the Berala cluster. So as we see, the disease is still bumbling along in the community, and we need to be vigilant about that, and that's why I'm pleading for people to come forward and get tested. Yesterday to 8 p.m. we only had 14,700 tests. We know it tends to dip down as a result of the weekend in the early days of the week, but we really need to have higher testing levels if we are to combat the rumblings that are still going on. And we know that it takes some time to completely get to the target of zero community transmission after there has been an outbreak, but it's so critical that we raise those testing levels. 14,700 isn't really enough for where we're up to in the pandemic, and whilst all of us have been so vigilant and so good in getting those testing rates up, we need to maintain that again to make sure we manage to get on top of the rumblings that are still there, because even though we lifted the stay-at-home restrictions for the citizens of the Northern Beaches, even though we've been repeating our messages about where we're up to in the pandemic, we still know that whilst those major super spreading events haven't repeated themselves, we know that there is still mopping up to do. The remnants of the disease are still there, and we can't allow any of those remnants to become or lead to another super spreading event, which takes us back to square one. So in order to prevent those major outbreaks, in order to make sure New South Wales maintains our position now of where we're at and actually moves forward in improving our position, we really need to get those testing rates up. Can I also stress and repeat the fact that it's so important for us, given the new strains of the virus, if you happen to be in quarantine or a loved one that you know is in quarantine and the onset of symptoms commence during the quarantine period, if you have one of those strains that are new, that are more vigorous, you will have to start the 14 days on the onset of symptoms. And we know that this time frame works and is appropriate because we are picking up infections, both from people who've been in isolation in quarantine, but also out in the community in isolation. We're still picking up cases in those last days of being in isolation. And it's really important to make sure that whether you're in isolation at home, that you stay there for the 14 days, and whether you're in quarantine, depending on the strain of virus you have, that you appreciate that even at the end of the 14 days, if you're still infectious, if you're still deemed to be infectious, you still need to make sure that, that you appreciate you could have to stay a few extra days as a result of that. So the strongest message today is please do not assume this outbreak is over in New South Wales. The rumblings are there, we're still mopping up. Whilst we're confident that there hasn't been another super spreading event, that's only for today. It can happen again if we don't stay vigilant, and we really need to get those testing rates up. And I'm appealing to the community, whether you have the mildest of symptoms, please make sure you come forward and get tested and follow the rules. If you are a casual contact or a close contact, please make sure you're looking up the health website consistently to see what venues are being put up there and whether you've been exposed. And we also appeal to people, and I want to say this point, and Dr McAnulty will repeat this point. Please make sure that if you are deemed to be positive or deemed to have been contacted by health officials, feel comfortable in telling us all your circumstances, the situation you found yourself in, where you've been, who your close contacts are, because that information empowers us to get on top of it very quickly. That information is not passed on to anybody. Health doesn't pass it on to me. They don't pass it on to anybody. That information is private and confidential. But what it does do is allow our experts to get on top of it as soon as possible, and that's really, really important. So if you do have someone in your family, or if you are someone who's been contacted by health, please feel comfortable to be open and transparent with all the information that you have, because that will ensure that we've prevented any new lines of transmission getting steam. I'll now hand over to Dr McAnulty to give his daily medical report, and then I will take questions. Thank you.